So the big story today, starting today, the coronavirus vaccination drive has been opened up to senior citizens and people with comorbidities who are over 45 years of age. That's those people who have some serious illnesses. Now, the registrations are open this morning at 9 and it is on the www.cowin.gov.in website and the Arogya Setu app. There will also be walk-in vaccinations in some places for registration to get vaccinated. Now, India began its vaccination drive on the 16th of January, and the plan was that in the first phase, where you have healthcare workers and frontline workers, 3 crore were expected to be vaccinated, but we've only vaccinated 1.43 crore so far. In a big boost to the vaccination drive, however, as it enters this next phase today, Prime Minister Narendra Modi took the COVID shot in the morning at Delhi's AIIMS hospital, becoming the first beneficiary in the second phase of the nationwide vaccination against coronavirus. Interestingly, he also took a dose of the homegrown Covaxin, which was developed by Bharat Biotech and the Indian Council of Medical Research, which has been linked to some extent of vaccine hesitancy because of its clinical trials status, because there's not enough data available on the clinical trials as well as the efficacy. So it's interesting the Prime Minister took Covaxin. There are 2 vaccines that are available in India, the Covishield, which is made by the Serum Institute of India, and that is the Oxford AstraZeneca vaccine. And then you have Covaxin, which was made by Bharat Biotech. Well, let's now go across to Dr. Shashank Joshi, member of the COVID-19 Task Force, Maharashtra, who joins us on the show. Thank you so much, Doctor, for taking time out. So it's an exciting day today, the next phase of the vaccinations, and this couldn't come sooner, opening it up to the elderly, because we do know cases of COVID are rising once again, especially in Maharashtra.
Absolutely, Gargi. Thank you for having me. I think it's a very welcome step that we have moved to the next phase. And I urge everybody who's eligible to get vaccinated without fear and prejudice. Get registered on the app, be a little patient, and ensure that the vaccination process runs smoothly. Don't worry which vaccine you are getting. Both the vaccines are safe and effective. Our Honorable Prime Minister has led from the front. And I think, there is nothing to panic or worry. But remember that independent of vaccination, we need to continue maintaining our COVID appropriate behavior and behave as responsible citizens, particularly on the masking front.
Right. And Dr. Joshi, also, as we said, the first phase of the vaccination was slightly disappointing, given that we expected 3 crore to be vaccinated by now among the, frontline and healthcare workers. We managed to vaccinate 1.4 crore, and we're hoping to reach the 30 crore mark in August sometime. So now with it opening up, are you hopeful that the vaccination drive will proceed very rapidly?
We are anticipating, Gargi, an exponential increase. The first phase and the first phase was a little slow. It had its own teething problems. They have redone the COVID app now, the COVID website. There were a lot of challenges technologically also, and there was a lot of hesitancy. I think all that is gone now. And also the private sector has been also very appropriately involved in an equitable fashion. So I personally think that there will be an exponential, larger vaccine drive in the most vulnerable and the most people who really need it the most. So I personally think that we'll meet these targets much before the anticipated.
All right, so that's a very optimistic view. However, on day one, we have seen there have been some, glitches, some issues. And then this, of course, was expected that there would be some sort of teething problems as people try to register. What are the challenges you see currently? And also, a lot of criticism has come in the way of COVID. People are saying, technology is coming in the way of really opening up the vaccination program. What are your views on this?
So, it's always the Gen Next and the young India, which is very tech savvy. And our senior citizens need to be handled with their, children or grandchildren. It's not an easy job at all. I mean, I have got several phone calls from anguished senior citizens. And I think for that, they have tried to make it hassle-free. I think within a week or 2 weeks, we'll see much more opening up. Let us wait and see. I'm a little cautiously optimistic that, we are allowing senior citizens walk-in who have technological challenges of using the app, having a mobile, having an SMS, because that's not easy for that generation. And that's the most vulnerable generation for COVID today. So I think that is something which we need to look at. I think the government has looked at it, and let's hope and pray that, this little hesitancy, hiccups, which we always see on day 1, day 2, they get ironed out very fast. I think the hiccups of the first phase were very protracted. They lingered for a long time. Most people who are frontline workers or healthcare workers have got their first shot, and they are now in the process of the second shot. So that definitely has been slow, but we hope and pray that now the fast track board will go in the week or two, and our senior citizens with minimal difficulty, minimal hassle, minimal anxiety will be able to get vaccinated. I think that everybody is in a rush to get it ASAP. I think people will need to be a little more patient, but I think the government authorities, the private sector authorities also need to be more responsive in communication and reassure them that everybody will get vaccination. The vaccine is safe, it's effective, and I think it's something which we need to reassure, but also ensure that the process is exponentially ramped up quick and fast.
All right, we're also joined by Dr. Sunila Garg, member of the COVID India Task Force. Thank you so much, Dr. Garg, for joining us. And as I was just discussing with Dr. Joshi, it's a very exciting day today, the vaccination program opening up now. And he's very optimistic that now it'll proceed exponentially, because we don't know in the first phase, there's been a slight disappointment. We were expecting 3 crore to be vaccinated, and it's 1.4 so far, 1.4 crore. And hopefully now we'll see a big surge in the vaccinations, especially given the boost of the Prime Minister receiving the first vaccine today.
Thank you so much. It's a very, very important question. We had a lot of vaccine hesitancy in the initial stage, and subsequently we saw that the vaccine hesitancy was going away. And towards the last stages of our second phase also, we saw a number of people who were coming even for Covaxin as well. So now, and many people were enthusiastic about when their chance will come. And now, since, we have opened up from today for plus 60 and people who are comorbids and above 45 years of age, hopefully we'll be able to see a very good response, because quite a number of them will be also those whose children are healthcare workers, frontline workers and all that. And those who have taken the vaccine will also be able to promote them. So a lot of things will change now. I feel that, people have been eagerly waiting, and they're seeing now this vaccine being there from January 16 onwards. And also our adverse events are even less than 0.0004%. So that's where it is that we have now reached the point where we can start. And our Prime Minister himself has acted as a role model for this phase. So hopefully we should be doing very, very well.
And ma'am, this will also test our health systems, isn't it? Because as I was discussing with Dr. Joshi, that everybody is not very tech savvy. So a lot of the private hospitals and government hospitals, especially in rural areas and towns, will have to do a lot of hand-holding and helping the elderly and the seniors, when they come there to get registered, isn't it? And is that something that you're thinking about currently?
Definitely. You see, this is where not only, we are talking on an app mode or digital mode, but a lot of importance, is now of the healthcare workers, of our systems, and also of the family members. And many people called me yesterday also, and I told them that just like, you take care of elderly otherwise also. And we are talking of now, old, particularly when people are above 80 years of age and all that, 60 to 70, they still work. 70 to 80, partially they are working, some of them are not working. But old people are the ones who will pose a challenge. So that's where our, family members and people who are, working in the health sector, they will play a very, very crucial role. And again, the strategies have to be very different for rural areas, urban slum areas also. But then again, we have to work on, as we go ahead, the whole scenario will go on unfolding. And there, we'll be able to, kind of take decisions accordingly. But as you rightly said, some are private sectors, some are, government sectors and all that. That is also a challenge. People will take time to understand. But I'm sure, like initial challenges, any program which is a big rollout program with 10,000 additional facilities in PMJY and 625 facilities in, CGHS dispensaries and, other state government covered dispensaries, they all will have initial challenge, because system will also take time to adopt to them. So, but we will be moving forward with that.
Right. Of course, on the day one, there will be some, sort of issues, some teething problems. We have lots of questions from our viewers, which I'd like to put to you. We had one tweet from Anviti Singh, who asked that first they said people with immune disorders should not get vaccinated. Now the circular states they are on priority. So what is the truth? Can people like me who have autoimmune and blood disorders get vaccinated or not? To you first, Dr. Garg.
I can't get you. Can't hear you.
Right, ma'am, it's a question from one of our viewers asking whether people, who have autoimmune disease and blood disorders get vaccinated. That initially she was under the impression that they couldn't, but now they're saying they should go ahead.
They should go ahead with that, and they have to consult their healthcare providers also. Dr. Joshi is already there with me. Some of the times they will say that if you're on blood thinners and all, maybe you can stop it about a day before and all that. But they must consult their healthcare providers before they go ahead for the vaccination. And as it is, when we are the general non-communicable disease, it's not a contraindication. But people who are, having some and all that, basically they should consult their providers. Maybe some medicines they need to be stopped and can go safely to the health facility also.
All right, we have another question from David, who wants to know, people with medical conditions, should one wait for private distribution so we get our choice of vaccine, or go with the government drive? Dr. Joshi, if you could take that question, and people still, waiting and thinking perhaps in a few months' time you'll have more of a choice, maybe, vaccines available in private.
I don't think we should wait at all. I think, as Madam Garg said, we should go ahead with whatever facility and access we have. And I think the only thing which you need to consult if you have a major comorbidity or a major illness is talk to your treating doctor or a treating specialist. For example, the previous person was asking, if you have an immunological disease like autoimmune disorders, talk to your rheumatologist, talk to your specialist, and in consultation with them, take a certificate, upload it on the app, and go ahead and take the vaccine. So I think it is important that do not wait. I think waiting will just not be the right attitude. I don't think it is public or private. I think whichever is the place, it's just an ordinary injection. You don't need a specialized place really to go to a private or a public sector for this. Wear your mask, go there and be comfortable. I don't think we should delay vaccination for a particular private sector to open. I don't think that's the right approach. We should go ahead and vaccinate and don't hesitate at all. But talk to your doctor. If your doctor says maybe it's not the right situation, your CRP level is high, you have a very bad allergic tendency, let the doctor and the vaccinating place decide on the beneficiary. We have had instances even with frontline workers in Mumbai where the vaccine center has turned the patient back, said, you are not even 1 month finished after COVID, your turn has come back after 2 months. So they have a protocol in place. The national vaccine protocols are all in place. Even when you go to the vaccination center, if they feel that they are not comfortable giving you the vaccine, they'll send you back. And some small amount of people who are not fitting in the criteria have been sent back, and they will be called back at a subsequent date.
So as the Prime Minister said, if you're eligible, please just go ahead and get yourself vaccinated. Book that slot. One final question we have from Adil Khan, who said that vaccines used in the vaccination drives took months to develop, and now we have new strains of virus. What is the efficacy rate of vaccines on the new strain of coronavirus? So, Dr. Garg, as some doctors have now started describing these variants as scariants, that people are just getting too scared of them. Your answer to that?
Definitely, basically now we are in the midst of a time where we have got mutant strains and all, but as of now, our vaccines are working. So before, our vaccines, they become ineffective, it is better that we start vaccinating our people in large numbers, and they also must understand this concept. Otherwise, over a period of time when the body will become resistant to, these vaccines as well. So it is important that we must vaccinate as much early as possible. And right now, people must understand that these vaccines are effective against the mutant strains as well.
Right. So very important points there for anybody who has doubts. Just go ahead and get vaccinated. If you're eligible, as the Prime Minister said, and the Prime Minister leading by example this morning by getting that vaccine shot. Thank you so much, Dr. Garg and Dr. Joshi, for sparing the time and speaking on the show and answering all those questions.
Thank you.
Well, with that, time for us to slip into a short break. Before that, here's a look at Venkaiah Naidu also getting his vaccination today. So not just the Prime Minister, but Venkaiah Naidu as well getting the vaccine on day one of the second phase of the vaccination drive. So a very important message being sent out there. Well, with that, time for us to slip into a short break. On the other side, we'll focus on the United States that has a third vaccine in place. The Johnson & Johnson vaccine has been approved. Welcome back. Let's focus on the United States and some good news there, where the U.S. regulators have formally approved the single-shot Johnson & Johnson vaccine, the third jab to be authorized there. The vaccine is said to be a cost-effective alternative to Pfizer and Moderna vaccines and can be stored in a refrigerator instead of a freezer. Also, for the first time since early November, fewer than 50,000 patients have been are hospitalized with COVID. Well, to talk more about this, we're now joined by Dr. Monica Gandhi, Professor of Medicine, University of California. Thank you so much, Dr. Gandhi, for joining us. Great news with the U.S. approving the single-shot Johnson & Johnson vaccine and a third vaccine in the U.S. to fight the pandemic.
Yes, I'm actually very excited about this because I think the more options that we have, the better chance we have to get people immunized. This is a one-shot, what's called adenovirus vector with DNA. So it's a combination of a little virus that brings in the DNA into the cell. It's one shot, like you said. The phase 3 trial showed that it's very effective, 100% against deaths and hospitalizations. It has variable efficacy against more mild disease across the variants. It was studied in South Africa, Brazil, and the U.S., and its efficacy was highest in the U.S., at 72%, 57% in South Africa, 66% in Latin America against mild disease. However, the hospitalizations and death were blocked across all three settings at 100% efficacy. So I think it's an exciting new option. It's important for us to have more vaccines here in this country.
And Dr. Gandhi, now many countries have had their vaccine drives in place for a few months now, and there's some sort of preliminary studies available from the UK, from Israel. What have we learned so far from them about, the vaccination and the infections?
I think what we've learned is that there's a race going on between the transmissibility of the virus and the vaccines. And Israel and the UK specifically have been moving much more quickly than the U.S. as a third example. Israel, because they had a deal with Pfizer, so they were giving out just this particular vaccine. UK, because they approved multiple options, the AstraZeneca with the Moderna Pfizer. They were giving it out nimbly. They were waiting 12 weeks between doses. And that combination of all of that has led to fast rollout in those two countries, which has yielded fruit. The cases and hospitalizations have gone down considerably. So it is a race, and the U.S. needs more to help them win the race.
Right, and even as this race is underway, there can be no room for laxity, isn't it? Because like here in India, we're seeing, vaccination drive is going on, the next phase has begun, but cases are rising as well. So people have to continue following all those COVID protocols.
Yes, it's really tricky, actually, because the more a virus replicates, the more it has a chance to mutate. And we want to keep transmission down as we're rolling out the vaccine. It doesn't have to fight the virus running around so quickly. It can calmly sort of give people immunity, and it's better if there's lower rates of transmission. So we're exhausted. Understandably, people have been kept away from friends and family for a long time. But think of it as just a while longer until we can get to better immunity. I keep on looking at those countries rolling out faster, and they have timelines that really make sense. They're keeping their lockdowns, but they will have timelines in the short future that they can release them.
Right, and you're talking about mutations. We keep hearing different things about the variants. Lots of you are calling them scariants now, that, it's spreading faster because of the variants. But there's been no categorical study on that front either. What can you tell us? We've also heard there's a New York variant now.
This is not unexpected that the virus along its spike protein would get these mutations. Some of them may be leading to spreading faster between two people, which is why our masks and distancing are so important. I don't think the virulence question is defined at all. You'd need more hospitalizations per case, and we are not seeing that. However, what's most important is if our natural immunity to infection, or if the vaccine-induced immunity won't work against the variants. And there is not evidence of that yet, which is why I think the scariance word is a fair word. We're scaring people. I don't want people to think, oh, I'm not going to even take this vaccine. It's not going to work. There are two arms of the immune system. There's antibodies and there are what are called T cells. T cells are very robust. They work across the whole spike protein, and they have not been shown to be able to evade these variants won't make you evade the immunity that you get from T cells. So people should just carry on, vaccinate, and not talk about the variants that much.
All right, Dr. Gandhi, thank you so much for taking time out and speaking to us at NDTV.